is there anything specific that you feel is the greatest unmet need in Parkinson's disease right now?
That's a tough question. I mean, it's almost $1 million question because Parkinson's, and I'm not punting the question, but Parkinson's disease is a very individualized illness. It affects patients in so many different ways. As I said, it involves every organ system in the body. And so for the Parkinson patient, the greatest unmet need is what they're most disabled at or by. So I would say there are top 5 unmet needs. So one would be the cure, and that'll always be number 1. And then if you poll Parkinson patients over and over, and you poll scientists over and over, the ones that we are least good at in offering them current treatments and also that is most bothersome to patients are 1, sparing their mind. Parkinson's disease affects your thinking. It's different from Alzheimer's disease, but it still affects thinking. And we don't have too many medications for it. The second one is balance, improving balance. That's also a big unmet need because Parkinson patients as the disease progresses can fall more frequently. And we don't really have any treatment for that other than physical therapy. And even physical therapy in the time of COVID is a challenge. It used to be something we don't even think about. And now, how do they get physical therapy? How do you go to the hospital? You can't even leave your house. And so that is a challenge now, which is even bigger compared to before. So that would be kind of my top 3. And then the 4th and the 5th will really depend on what the patient is suffering from. One big thing is what we call motor fluctuations. As the disease progresses, the medication we give 3 times a day, they don't last for 4 hours or 5 hours. They only last for 1 hour or 2 hours. And then they're waiting. They're in this kind of limbo state of waiting for the next medication. And then they have a good 1 hour of on time. And then they're waiting again for their next dosing. Otherwise, they have to take a pill every hour or every 2 hours, which is not living. And so motor fluctuations is yet another source of disability and an unmet need for patients. And then the last, which we don't talk about a whole lot, because when I ask you to close your eyes and imagine someone with Parkinson's, you would imagine someone who's shaking like a leaf, who's tremoring and can't walk. That is true, but that is the tip of the iceberg in Parkinson's disease. What lurks underneath are these constellation of non-motor symptoms: depression, anxiety, psychosis or hallucinations, fatigue, urinary problems, constipation, insomnia. That is even more disabling than the tremor that everyone sees in Parkinson patients. And so that whole bundle of non-motor symptoms is a big unmet need because we're not studying it a whole lot. We're focusing on tremor, but what about how they feel, how they think, how they sleep, how they eat? That's just as big a problem as how they walk and whether they're shaking or not shaking. And so to me, those would be top 5.